Welcome, everyone. Thank you so much for joining us. We're going to hold on just a minute here while our platform's letting everyone in. So feel free to use the chat while we're waiting, give us a greeting, and let us know where you're tuning in from today. We'd love to hear from you. Also note that your microphones and your cameras are automatically turned off, and you won't be able to turn those on during today's presentation, but we encourage you to use the chat to ask your questions, make your comments, and communicate through there. Hello, hi everyone. We see a question about the recording. Yes, we are recording right now, and we will be sending that out to everyone. Welcome. Oh, I love seeing everyone from all over. We will get started in just a minute here. So if you're just joining us, we're just letting our platform let everyone in. As you can see, we have introductions happening in the chat. So feel free to head into the chat, let us know who you are, where you're tuning in from today, and give us a greeting. Wonderful. Well, I'm going to go ahead and get started. Hi, everyone. Thank you for joining us today, and welcome to our webinar, MHA's 2023 Bell Seal for Workplace Mental Health, what it is and how to apply. We'll be going through all of those details this afternoon with you. My name is Jackie Zimmerman. I'm the Public Education Associate at Mental Health America's National Office, and I'll be moderating today's webinar. I have just a few notes for you before we get started today, and I introduce our speaker. This webinar is being recorded and will be sent out to all registrants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, you can do so. We will have the link to request that going out in follow-up materials. You'll also note that you're automatically muted and your cameras are off. We ask that you use the chat today to communicate. Please feel free to ask your questions throughout today's presentation. I'll be collecting those as Taylor's presenting, and then at the end, we'll have a little time for Q&A where we can go through some of those. And now I'd love to introduce today's presenter, Taylor Adams. Taylor serves as Mental Health America's Director of Workplace Mental Health. She spearheads Mental Health America's efforts on its workplace mental health initiatives, including its Bell Seal National Employer Recognition Program and annual Mind the Workplace research. She incorporates her lived experience and professional expertise to support employers seeking to support the mental health and well-being of its workforce. Welcome, Taylor. We're so excited to have you here with us today and be able to share more about Bell Seal. So I will hand it over to you and let you take it away.
Great, thank you, Jackie. I really appreciate that. So yeah, my name is Taylor. I am currently wearing a white t-shirt with a blue blazer, and I have blue gold earrings on, although I don't actually think it's showing up, and I have brown hair. I want to say thank you for everyone who's joining us live today. While we are recording this, and hopefully it could be a resource you need to, you can go back to as needed. But also, like, any questions that you want answered live, we'll be able to do that at the end as well. So let's get into it here. Oh, we might have some trouble hearing, but sometimes that's because I'm a very soft-spoken person. So I'll pull up a little bit, see if that helps. Okay. All right, great. And Jackie, if you're able to pass control over, because it looks like I don't have that option at the moment. There we go. All right, great. So some of the things that I want to cover today, clearly I'd like to go over the Bell Seal for Workplace Mental Health program that MHA offers. This includes the criteria, the process of applying, as well as the benefits for participating in the program. I'll share a little bit about how our past, our 2021 to 2022 recipients contributed to worker mental health and well-being, just some examples there. And then finally, we'll review a couple resources on how you can both support your workers' well-being just in general, but also prepare for the Bell Seal application. I love that people are already posting questions, so that's super cool. So most of you are probably familiar with Mental Health America, but I did just want to give a bit of background. We are the nation's leading community-based advocacy organization dedicated to addressing the needs of those living with mental illness, as well as promoting overall mental wellness. We're guided by our before stage 4 philosophy, so we want to treat the emerging signs and symptoms of a mental health condition long before it reaches that point of crisis, just like you would with a physical health or chronic health condition. So many of our programs are taking a prevention and earlier intervention approach, including our workplace mental health initiatives. I do have a couple questions for the audience. It isn't a poll or anything that pops up. It'll just be on the screen here. And it's something that if you're comfortable sharing, personal experience, general experience that you have, would love for you to drop your responses in the chat here. But essentially what brings you here today? Why does worker mental health and well-being matter to you? And this could be personally, this could be within your position. And we'll just kind of keep flowing since we have a lot to cover, but I would love for folks to share any response they'd like in the chat if they feel comfortable doing so. Okay, so I will not spend too much time on why this is important because there's a clear reason why all of you are joining me here today. This is probably top of mind for you. It's probably something that you're working on within your own organization, or you're just curious learning more about. But I did kind of want to bring this into, why is this important? For me personally, this is not the type of work I saw myself getting into when I was young, but I've been with Mental Health America about 6 years now, and I always think back to that time when I was a student, but also worked at a fast food restaurant that had a bit of a toxic culture, a little bit of trouble following minor labor laws. And at the time, I just couldn't understand why I was struggling, with my mental health, my emotional health, struggling to balance those two responsibilities. And I ended up writing in this article in our school newspaper about how to advocate for yourself as a worker and take care of yourself while being a student. And it wasn't until a couple of years ago did I make that connection that, this is something that's really important to me personally. And I'm someone who lives with depression, anxiety, and post-traumatic stress disorder. I have found a really wonderful home in Mental Health America where they create an environment where I feel safe talking about that publicly. So anyway, just the slide that you see here, this is it. I apologize for the small text, but this is pulling snippets from an infographic we created about prioritizing workplace mental health. Just some stats here, some research that we found. But really what I want to express here is that we want to encourage workplace policies and practices rooted in prevention and early intervention, and that holistically support workers' mental health and well-being. So with all that context shared, I'm happy to share more information about our Bell Seal for Workplace Mental Health program. So the Bell Seal is a national certification program to recognize and also elevate some of the practices of employers that are committed to creating mentally healthy workplaces. There are quite a few other countries that have, standards that they've set for psychological safety in the workplace. New Zealand, United Kingdom, Canada, for example, but the US, up until recently, where the Surgeon General published the framework for mentally healthy workplace, there really wasn't that standard. So this is a program that we launched back in 2019. We have since had 115 organizations participate in the program, and we're currently in our third cycle this year and accepting applications at the moment. And just to give you a sense of the type of organizations that apply, so it's a wide range of industries, everywhere from healthcare, nonprofit, public sector, education, to financial services, food and beverage. We have a couple of construction and manufacturing organizations that have participated. So really wide range in the type of function and industry that's represented. Also, we have a wide range in the organizational size. So that includes About 23% of our recipients are organizations with 50 or fewer workers, and then 40% are organizations with 1,000 or more. So all that to say, it was, and this has been years of adapting and evolving and making sure that the criteria was accessible and applicable to that range of industry and size, because we want any organization to feel like they're empowered to apply and that they can improve that score year to year, and that this is accessible for everyone. And also just a fun fact, our Bell Seal certified organizations represent a combined workforce of 2.3 million workers. So that's something I'm particularly proud of, and that we've created these standards that are being enforced in these workplaces and hopefully supporting those workers. So, and I'll just say, so there are links I've included in the slides, and that will be sent after the webinar. But also, if you just wanted to type that into your browser, this will take you directly to the main site for the program, and you'll see all the current recipients, FAQ. There's a lot. If you want to dive in deeper and there's something that isn't covered by this presentation or the Q&A, everything will be there as well. So I wanted to talk a little bit about why we wanted to create this program, why it was so important to have this standard. So here are the 4 pillars that we've outlined in the creation of this program, starting with unmatched expertise. So we wanted to create a pretty rigorous and comprehensive evaluation that holds organizations accountable to certain standards. So and we are a leading mental health advocacy organization, so we thought we might be in a good position to do those evaluations. We also want this to be a distinct standard of excellence. It is very thorough. We look at, and we'll definitely go through all the different components that we evaluate, but we don't want people to just check the box. We want people to feel like it carries genuine meaning and makes them feel really good about the work that they're doing in workplace health and well-being. I've had some feedback, and a big part of this program has just been listening to the folks who participate, hearing their feedback, hearing about what works and doesn't work. And one thing that has come up is someone described it as a workplace mental health policy audit, which I used to work for our finance team at MHA, and anytime I hear the word audit, it makes me cringe. But in this case, I'm like, oh, okay, so this does feel like a very thorough review of that, and it does mean something. We want this to be recognition that resonates. So workplace mental health is no longer this additional perk that's offered. It's not like a nice thing to have. It should be integrated as part of the fiber of an organization. And we're seeing that with this emerging workforce, that's becoming the expectation, that mental health is addressed, that there is something part of the overall strategy. So having that external validation from this program lets both your current staff, but also potential new hires know that you do care about culture and employee experience, and it's not just a talking point, it's actually been evaluated. And then finally, and this will come up a couple more times as we go along, but we want this program to feel like a collaborative process. It's not so much, you submit your application, you get the results, and then you don't hear from us. We really like the idea of engaging folks who participate in this in multiple different ways, trying to meet the needs of what your goals are and what you want to pursue. So, there's a lot of different options there, and we'll talk about that in just a moment. And I do see your, I'm trying hard not to get distracted by the little comments popping up, but I do see those questions and plan to address some of those at the end. So thank you for already dropping those in the chat there. So the Bell Seal does have 4 levels of recognition. Bronze, silver, gold, and platinum is our top tier. There are also a couple, I don't have the actual URL link spelled out here, but those are linked in the slides. When you receive them, you can go to them. But I just wanted to share about this. So if an organization meets the 50 points out of the total 100 that makes up the application, then they qualify for bronze level. So you have to meet at least 50% of the criteria to be considered for one of these 4 levels. I will say that a majority of our current recipients have achieved gold or platinum status. So a lot of people who have been entering the program are achieving those meeting that high criteria. And then we're seeing from last year that organizations who renewed their certification do see either an increase in their score or they've maintained their score from the previous year. So they have been making changes and seeing some of that impact on their workforce. I want to share this not to discourage folks, but just to give it as another resource and just put some context on how rigorous this certification can be. We have, so you'll see here on the screen, the pre-assessment, Bell Seal for Workplace Mental Health. This is a tool that employers can use. It's about a 20 something item checklist, so pretty couple minutes to complete, but it will provide you with a preliminary score. So which level of recognition you might fall into without, even beginning the application process, just to get a sense of where you might land. 87% of organizations who've used that tool don't qualify yet for certification. So they're, but not to discourage anyone to say this is unobtainable, but it is a really good balance of, for those organizations that this has been top of mind. They're thinking about workplace health. They've been implementing some programs the last couple of years or so, or over the course of COVID-19, they've implemented new things or improved things. But if you do, you're unsure of where you fall, that's a really good tool to use there. Okay, so I may have left, there's a lot I can share about the process itself. So any questions about what that or what the program's all about, please drop those questions. But I'm going to move into the second part of this, which is what exactly is the criteria? What are we looking for as part of this? And to make it as easy as possible, I actually pulled those checklist items from the pre-assessment and broke it down into these categories so you can see exactly what we have here. So the application is broken into 4 main categories. We have supportive workplace culture, benefits that support mental health, holistic wellness at work, and caring beyond compliance. The 2 largest, and I'd say that are scored the most heavily, are workplace culture and benefits at 70 points total, 35 points each. So this is really going to be where the bulk of the application is in these 2 sections. So when it comes to supportive workplace culture, some of the things that we're looking for is, does the employer have a tailored and responsive approach to measuring and addressing workers' mental health needs? So that, for example, an engagement survey, doing regular pulse checks with your organization. I've had some who do daily check-ins and they just use like a scale of 1 to 5 on how you're feeling. So I will say a lot of this criteria is kept very broad. Again, so we can capture a lot of different organizations who do it different ways and learn from that. And also not limit it to any one practice, because there are some things that just work better for some organizations than others. So some type of measurement tool, some type of survey that you use within your workplace to assess things like stress, burnout, and impact of work on maybe your relationships, sleep, other areas of your life, work-life balance, are some of the examples there. And then, is there a response to employees' feedback? So whether that's a change in policy, the introduction of a new program or intervention. So that's the first part, and I think it's a good 8 to 10 points of it. So it's a significant chunk, about 10% of the total application. But some of the other things that we look at in culture include having a designated team or individual to identify, strategize, and address mental health concerns in the workplace, or improve workplace culture. We kind of group those things together a little bit. And this could be a paid position. This could be your employee resource groups, an affinity group, a committee. So someone that just represents that role within an organization. We also look at how organizations promote mental health in the workplace. So it could be new hire orientation, offering trainings, having wellness events. Again, very broadly defined, but how is that being promoted within the workplace? A really big piece of it, and I think, again, this is probably accounts for 5 to 10% of the application, is around fair and effective management. This is something year after year in the decade or so of research that we've done. Having fair and effective management has been a really key indicator of poor or positive worker mental health outcomes. So we do look at, is there a strategy to promote fair and effective management? Are there specific practices being followed that are detailed in the application? Are workers encouraged to provide feedback on how their manager could be serving them better, supporting them? So those are the type of questions that we ask there. I apologize, I went forward a bit here. And then the final piece is opportunities for professional growth. So that is like the heftiest part of it. And then moving into the next category, we look specifically at benefits that support mental health. Four main areas again, we look at health insurance that's offered, or maybe some alternative ways that people offer access to healthcare. We look at an employee assistance program or similar program that's being offered. We look at paid time off, how it's being promoted, the number of days or hours that are given. And then finally, we look at things like different leave policies and wage coverage, especially as it relates to people living with a mental health condition or substance use condition in the workplace. Just thing I want to note, and that's not exclusive to this section, but many of the questions that form this application, we want it to, I would say about 50% apply to workers who live with mental health or substance use conditions, and then the other 50% are just broadly applicable to your workforce. So encouraging everyone's health and well-being. So some questions get very, very specific and some are more broad, but just want to share that little nugget there. Okay. And I did combine our caring beyond compliance and holistic wellness at work section into this one slide. They are smaller parts of the application. This is, I think, 25% of it. But what we're really looking for here is we ask, how the employer considers diversity, equity, inclusion as part of its overall mental health strategy. And I know for individuals that they're part of affinity groups or employee resource groups, there's often a lot of overlap in like the goals and events that maybe DEI and mental health or disability can do. So we're kind of looking at where is that relationship happening within your workplace. In addition, we look at what type of preventative policies or practices are in place to encourage people to ask for help and feel comfortable doing so. So different reporting procedures, how accessible is that? I sometimes get feedback from organizations where it's like, yeah, we haven't really heard any feedback from employees. I don't think there's anything that they're upset with. And it's like, they may not be comfortable speaking up, or maybe there is an avenue for them to do that in a way that makes them feel safe and makes them feel like they're protected within their position. One thing that stuck with me, so in addition to all the work that I do for MHA, I like to craft and sell my crafts on the side. And I remember reading this book about receiving reviews from customers and all of that. And one of the comments was, for every one negative review you get, there's probably 10 people there who are thinking similar thoughts but are not sharing it. So it just kind of made me think back to this work of it's likely that if people are not speaking up, it's thinking about those processes is important there. And then finally, the last bit, the holistic wellness at work, is kind of the catch-all for anything we didn't include as part of benefits. So flexible work arrangements, remote work options, any type of additional support that you provide to contribute to a better life-work blend or balance. I like to think of like additional resources that support, other social determinants of health. So looking at financial wellness, or looking at, childcare for working parents and things like that. So, and then last, but having some type of physical health program. It is a lot. It's a lot of that we look at, because we do want to look at every facet, not just one part, not just focus on culture benefits, because a lot of these things kind of work together to create that culture and environment. And of course, if you have anything specific, a question about any one of these things, please let me know and we'll answer it at the end. So the next question that I have for all of you, and only if you feel comfortable sharing, please drop it in the chat. But after kind of hearing some of the general themes of the criteria that we're looking at, what might be some areas that your organization does well? Maybe you have a very strong culture. Maybe you do really well with benefits. Maybe you have really awesome policies in place. So I'd love to hear. We'll start with the good, and then we can get into the nitty gritty at the end. But love to hear some of the things that you think your organization is doing well in the chat. And I am slowly going to transition here to the application process itself. So the way to get started, and again, this is linked in the slides that people will receive at the end. It's also on mhanational.org/bestemployers. You'll find the link to this. But the very first step in getting started is submitting an employer information form. And all we ask is, point of contact name, an email, organization name, I think number of estimated number of workers, and that'll kickstart the process once you submit that. So within 1 to 3 business days, you should receive an email that has access to the online application, and this is what you'll submit to get those, to go through the evaluation and receive your results. The application itself is 58 total questions. Majority of them are yes or no questions or fill in response, like a numeric or percentage. But there are 8 open-ended questions, and we do think it's important to include because one, it's incredibly difficult to capture something like culture on an online application, and we do want to leave that space for people to expand on some of their responses. There is no documentation required. We want to make this application as easy as possible for people to complete. Although if some people have uploaded supplemental materials, or if they've gone over on their answers with the character limit, they've submitted extra documentation, there's an option at the end to include some of those items, but it's definitely not required. I think I would say it really depends on the organization, but it should only take maybe 1 to 2 hours to complete the application. And the most time-consuming part has been, especially because there's many different facets that are covered, just pulling and communicating with different teams and departments. So you're likely going to be working with your HR team, your benefits team, your employee resource groups, leadership might have some input on some things, DEI committee. So I think, it depends how long it might take for the organization, but that seems to be the most time consuming, is just pulling all this information into one place, which is probably why people describe it as an audit. So there is a cost to the application, ranges from 100 to, estimate $300 to $300 depending on the size of the employer. So 50 or fewer employees is 100, and then 1,000 plus is 300, and then it's 200 for the size organizations in between. This is simply just to cover the time it takes for our team we have a couple of people who evaluate the application. We do set up 30-minute calls after to review the results in more detail. It just covers our time and goes back into MHA programming. We have offered, different discounts and things, and we work with a lot of organizations because we do want this to be accessible for everyone. So this year we opened up the application cycle back in September, but it's a pretty big window, and we do have the deadline coming up March 31st, 2023. So if you are thinking about doing this, we have about 5 or 6 weeks left to pull it together. So once your application is submitted, you will receive the results within, we say within 15 business days. Usually it's sooner. And then at that point, we will schedule a 30-minute call where we go into the results in a little bit more detail. And I will say, once you receive your score, I like to say it's kind of your preliminary results, because oftentimes when we hop on the call, there are some questions we clarify. There are some things that we talk through that's like, oh, I forgot to include this in the application, or oh, I didn't know that applied. So it's a really good time just to kind of like get a chance to meet each other and clarify any of those items during that 30-minute call. And then if there are some areas that you want to work on, or you were hoping to score better on, we have like a resource and content for absolutely everything. So then we'll kind of identify what those things are and send in a follow-up email. And then another piece, some other time on that call is spent talking about next steps in terms of how we plan to promote this, what's available to you to promote it, and we'll talk about that in just a second. And then between March and May, we are kind of finishing up those evaluations and going through those calls. And then early June, we'll publish the full list of the cycle's recipients. And it's also something that we share at our annual conference, kind of on that one place. And I have a separate slide on that. But first, here are just some of the benefits associated with the program. And this is more of like, I guess, your tangible benefits, like as part of it, but there are definitely a lot of intangible benefits in terms of evaluating your organization, being able to benchmark yourself against other companies who have gone through this process, doing that audit of your current policies and practices. But some of the other things that we do is we want to promote the work that you're doing and be able to share that with other recipients or employers who are aspiring to apply for this program. And all this is at discretion of the employer, and we try to work closely with them to, make sure nothing gets published or put anywhere without explicit permission to do so. But at the employer's discretion, we do include the recipient's logo on our Bell Seal website, listed with all the other recipients and at which level of recognition they received. We also share it on a bi-weekly basis on our social media and in our national newsletter, which has a really great reach. And then we do kind of formally recognize the recipients at our conference in June, which I'll share in just a moment. In addition, we'll provide recipients with a promotion toolkit. This includes things like internal email templates, a drop-in article for a newsletter, social media graphics, language, the logo itself, which some people have used in their email signature. So I think one put on their business card, just like, oh, that's so cool. And just use the logo in different places, maybe on their website. But basically everything you need to hopefully share the news with this and share it with your network. And we're very, I think we do a pretty good job of anything that might be missing from that promotion toolkit. Just reach out, let us know. It's like, oh, or can you provide a quote? We're happy to accommodate that. And then in June, we'll share with all of our recipients the publication that serves two purposes. It is just the full list of the recipients, so you can see who you participated in with this year. But then also it's a bit of a benchmarking tool. So we'll look at all the outcomes, we'll look at all the aggregated data and pull it together in this publication that you can have that'll be available in June. And then also we have a quarterly workplace wellness newsletter, just another opportunity to, we include news of other Bell Seal recipients and what they're up to. We have a lot of our MHA programming that we'll share through that, any upcoming opportunities with MHA collaborators as it relates to workplace mental health, and then just some trends that we're seeing in workplace practice and different articles there. And then finally, like I mentioned before, we do want this to be more collaborative than just like receiving your results and then you don't really hear from us. So there are always, and it just depends on the year and the activities that we're doing for the year, but there are always opportunities to kind of work together beyond just Bell Seal. So we have invited individuals from organizations to participate in panel discussions, speaking engagements. Last year, we released our workplace mental health toolkit in September. We had over 20 organizations, their programs that were mentioned in the application represented within that toolkit as an example for other employers. And again, this was all with permission. If this is something you'd like to include, we reach out with those opportunities as they come up. And I mentioned the conference a couple times. I just wanted to show you kind of what that looks like. So MHA hosts its conference in June every year. It is a hybrid event. We usually have over 8,000 plus attendees and this is mental health advocates, practitioners, clinicians, just a wide range of individuals represented. So this is the time that we kind of formally acknowledge our recipients, both on the virtual platform as well as the in-person event in Washington, D.C. Just another benefit that I didn't mention, but if you are a Bell Seal recipient, they anyone within your organization that's interested in participating does get 10% discount on in-person conference registration. Otherwise, it's virtual as well, and that's free for anyone to attend. It's not workplace mental health specific. Sometimes there are sessions focused on that, but this really is kind of covers a broad range of mental health topics and things. And that's just on the screen is an example of what that looks like and gets shared with folks. Okay. All right, so last piece here before I transition to our next question. Sorry, I'm like losing my place. So I mentioned the brief a couple of times that comes out in June. This is just, again, it's a way for us to take everything we've learned over the course of like 100+ companies, what they're doing in this space, and we identify a couple themes that come up. And some are surprising, some that we didn't initially tie to workplace mental health, and then it turns out like this is what workers are asking for, and this is how they meet their needs. So at the bottom of the page, you'll see a link that you can use to get access to this brief. It is publicly available, and we do have specific examples of how people are implementing these different ideas, but I just wanted to kind of briefly go over some of the themes that we found. Of course, and if you're thinking about the timeline, this was over the course of COVID-19, where organizations were making pretty significant changes within their workplace. The first one being increased or improved mental health benefits and additional resource support was a really big theme. One that surprised me and also excites me is a lot of organizations were responding to workers' kind of reevaluation of their own life priorities, their own sense of work-life balance and what's important to them. So doing compensation equity audits, restructuring roles to better meet employees' needs. You know, I cannot remember where I heard this from, but instead of it being like, are you a good fit for the organization? It's like, how are you, adding to the organization, but by what makes you different? So thinking about it in those terms came up pretty consistently with some past recipients. Other things like implemented permanent flexible work schedules or enhanced leave policies. This doesn't necessarily mean having to go full remote or, some organizations have done that, but this also just means providing an hour a week that someone could attend a doctor's appointment or a therapy appointment outside of like, or within those normal working hours. Encourage employee resilience and provided mental health education, so really ramped up their efforts with different types of training topics. Suggested balanced approaches to daily interactions and scheduled meetings. So more organizations were introducing this idea of emotional intelligence and how to interact with your coworkers and how to maintain good boundaries, especially because it felt like if you were one of the folks who transitioned to a different type of work environment, was a little bit difficult to balance. So putting calendar holds, these are just some examples there. And then finally, maintaining connection and trying to help mitigate some of that social isolation among colleagues. Something that we're still kind of seeing a trend while remote work has a lot of good benefits in helping balance life and work. It also could affect, relationships within the workplace that, there's organic conversations, the water cooler chat. So many organizations had the opportunity to think about what that means in a changing work environment. Okay. So my third and final question for you, and of course, only if you're comfortable sharing, but if you can think of any areas that might be potential growth opportunities for your organization. So now that we've looked at some of the criteria, talked a little bit about what people are doing well, if you're comfortable sharing, what could be improved in your organization? What would you like to see more of? And I'm going to transition here now to what are some of the things that can help support you in those efforts? So I mentioned we released a workplace mental health toolkit back in September. It included, several different examples of employers who have put these recommendations into practice. I think all of them were Bell Seal recipients. Similar to if you're familiar with our Mental Health Month toolkits or BIPOC Mental Health Month toolkit, provides free practical resources for, there's information for employers, leadership, HR professionals, people leaders, and then workers themselves who want to advocate for mental health in the workplace. The two items that we cover is around workplace culture and benefits. We don't cover the holistic wellness at work or compliance as much, and that's something we hope to do for this year's toolkit. So stay tuned for that. If you haven't seen this already or you haven't been able to download it, the link is at the bottom, so you can see the full toolkit. It is, it's like 40 plus pages, and the number one piece of feedback I've heard is that it's overwhelming overwhelming to get through. It's a ton of content. But for that reason, it's kind of good to go through and see, just pick out what works for you, right? And I'll go through just very quickly some of the things that are available that may or may not resonate, but we'll see. So with that, for example, if one of the areas that you wanted to shore up within your workplace is how to promote that more, how to get that conversation started. A lot of the times you have your, it's one individual who's a wellness champion or ambassador. You have your employee resource groups, your affinity groups that are leading the charge on making this conversation happen within their workplace, especially if they don't have maybe as much support as they would like with leadership. So some downloadable tools that we have, and a lot of this is just plug and play, include having a case statement for why workplace mental health is important. So if you are an employee resource group who's seeking some type of budget to host an event, or you're looking to allocate hours to dedicate to these activities outside of your already, overwhelming workload, this kind of puts into perspective of how much is this costing our organization? What are the facts? Why is this so beneficial that we prioritize mental health in the workplace? And you can literally copy and paste and fill in where needed. And then there's things like tips on how to plan a wellness event, email template for promoting mental health, just generally at the HR level or within your team. We have a couple of items that are printable. So there's a poster as well as a postcard that includes the link and QR code to online mental health screening that's anonymous and confidential. I remember way back when I would do tabling events for Mental Health America, and people found it a lot easier. We'd offer screening there, but because it's a very personal thing. So some people found it easier to take that card with them, and then they take the screening at home. So that's why we include the QR code and make sure it's important that there are printable options available as well. A lot here that I didn't even get into, but that's just some of the examples that we have, because I realize I'm taking up more time than I meant to. The second bit here I just want to share is maybe you want to educate your workers about available benefits. This comes up a lot, especially when maybe an employee assistance program is being underutilized, even if it's provided. So we have some resources here, including checklist, 19 questions to ask your benefits broker or employee assistance program to make sure, that it is covering mental health and substance use needs of workers who try to access their benefits or EAP. How to introduce mental health during new hire orientation, just kind of like a couple tips and tricks there. There's internal email templates. So trying to just make it easy as possible that if you are doing like a quarterly reminder of like, make sure you take time off, that's included too. And then finally, and this comes up a lot because like I said, almost 25% of our recipients are smaller organizations with 50 or fewer, but what are some workplace mental health solutions for small employers, especially as it relates to benefits and maybe being limited in some capacity. We have a little bit of a fact sheet for that as well. Okay, last slide, and then I will leave us time for any questions. So if there isn't a single thing that you can find in this lengthy 40-page document, at the very least, we do just have a couple lists of things like free or at cost mental health training resources from some of our partners. So some focused on people management, some have a focus on a particular topic like suicide prevention in the workplace or crisis management. So there's just a really great list there, as well as access to all of MHA's resources, which Jackie does a fantastic job of pulling together and covering a wide range of topics there. We also have just a list of additional MHA resources. So if you ever wanted to get access to the Mental Health Month campaign materials. I'm seeing that increasingly being used more within a workplace context. Some of those same plug and play materials with the toolkit we just talked about. Also has information about the online mental health screening program and things like that. And then finally, just a list of our MHA partners and collaborators who offer different types of services. So just depending on what your needs are, there's a topic there's a topic for everything there. Again, if you wanted to take a look at this toolkit, and like I mentioned, it really, and this goes for the Bell-Seal program as well. We just want folks to have everything at their fingertips to try to, kind of get the ball rolling, get started with this, figure out what direction they want to go, because there's several different ones you can take. With the Bell-Seal program, oftentimes people are not interested in that recognition piece or submitting that full application, but then they'll use that application criteria as a framework for what they want to do within their own workplace, and then kind of supplement it with some of the information in the toolkit about how to do that. So this toolkit parts is just generally supporting your workforce and figuring out what direction you want to take, but then also helps prepare people for the application as well. So with that, these are just some of those links. They'll be available, but I'm going to turn it back to Jackie, who's going to moderate our Q&A.
Thank you so much, Taylor. Just a reminder to everyone, like Taylor said, all of those links, the contact information, I know a few of you asked about the toolkit, that will all be sent out to everyone so that you have access to those great materials. The toolkit is especially helpful if you're starting to feel, and maybe you took that initial survey, like Taylor said, it's quite rigorous, because it is important that those organizations that are achieving these recognitions are held to those high standards. So if you took it and maybe you're not quite there yet, the toolkit and those resources are great places to start, to kind of look at where can we start to build some of these practices in, or what are some of those focus areas that our organization can zone in on. So all of that will be sent out to everyone. Thank you all for so many of the great questions throughout today. I've pulled a few that we can go through in these last few minutes. But also thank you for everyone who's been putting resources in the chat as well. I know it's helpful to learn from each other. So you all have provided great information in there. Let me pull a few questions. Taylor, I'll start with a few that are specific to certain requirements of Bell-Seal. One person asked, does the Bell-Seal require US only employees? One of the organizations that asked is based in the US, but has employees all over the
world. Right. Oh, that's a great question. I'm sad I didn't already include that. So this is because we focus, so much of the criteria focuses on US federal regulation as it relates to Americans with Disabilities Act. We talk about the Family Medical Leave Act. We have a lot of criteria that references employer-sponsored healthcare. So it does apply to organizations that have a headquarters or a physical site in the US with a US workforce. But that doesn't extend to, if it is an international organization, then it won't cover your workers in Canada that are kind of following some of those different regulations. I have in the past, so we've had several organizations that have a global presence, but then they focus just on their US workforce. But I've shared examples of similar programs that we've seen in Canada, the UK. So just so if you're looking to do something like that with other parts of the world, that's available too.
Absolutely. Thank you for that. Another individual, we had a few questions coming in regarding mental health insurance and what that looks like within the Bell-Seal requirements. And someone was specifically asking about recommendations for expecting mental health insurance coverage. What do those type of questions or requirements look like within the Bell-Seal application?
Yeah, I'm like, hold on, I'm gonna literally pull it up to have in front of me and go through. So we ask about, and this is based on the Affordable Care Act definition of the different levels of insurance that are offered. And I know this looks different for employers that offer like they're self-insured, but it's kind of that's the criteria that we're using there. So we look at the level that you offer, which funnily enough and unrelated to Bell Seal is that bronze, silver, gold, and platinum level. And then how much how much of that health insurance is being covered by the employer, so percentage of coverage. And those points are allocated on, it depends. It's like 1 through 5 points, so a pretty big chunk. Some of the other things that we look at is if there's a certain level of health insurance coverage available for a worker's family. There's quite a few questions that ask about how some of these benefits extend to an employee's family. We ask if the employer verifies if their behavioral health networks with their insurance plans are adequate. And just with that, we mean, do they, even if you're a small organization, you do like a secret shopper where you call in once a year to see what the experience of trying to get access to care is, or you're receiving those reports from your benefits broker about how the insurance is being used. So this just, we want to prevent the experience of someone who's trying to get access to a behavioral health care provider. They go on that online directory, they try to see what's covered under the insurance, and a lot of the times it takes several months to get access to care, or they don't actually accept that insurance any longer, or they're not accepting new patients. So it's just kind of these out of date directories. Are you staying on top of verifying that that's not the case? And then the last piece we ask about is the type of mental health and substance use services that are covered with the insurance. So everything from talk therapy, inpatient, outpatient treatment, rehabilitation. There's a kind of like a checklist of things that we ask for that.
Absolutely. Thanks, Taylor. And I know a lot of people have been sharing experiences in the chat with frustration of EAPs and insurance coverage, and just in workplace mental health and outside of it, we always see access to care as being one of the biggest struggles. So it is so important that that is a large focus of the Bell Seal, and there are lots of different ways that that can be addressed through it. So thank you. A few logistical questions here. Someone asked, I know you mentioned that this window will be closing at the end of March for the Bell Seal application. When would that next window be for Bell Seal applications?
Yeah, so we'll reopen the next cycle. I don't have the exact date, but in September of this year. So from, I would say about mid-September, around the same time that we'll be releasing the next toolkit, through March of 2024, there's a lot of time to apply. Some of the things are just one thing I want to note here. We've had a few organizations that have applied in that September window, but then they've implemented or put things in place after they've had a 30-minute call with us, and we kind of talked about what are some things they can do where it improves their score before that March 31st deadline. So you can bump those recognition levels, you can improve your score. Like I said, it's a very fluid process, so we don't want anyone to be deterred from applying early if they're looking for a little bit more guidance on how to increase their score. That's an option.
Absolutely. And a few more questions I see coming in. Do you have to reapply yearly then? And how long does that certification period last?
Yeah, so it is an annual certification. I'm getting some feedback from folks who have renewed for this year to see what the recertification looks like, but it seems pretty straightforward. It's not as intensive as the first time you submit, because people just kind of make changes to what they previously shared. They also, if there were any questions that we might have changed, which sometimes year to year, just to keep it relevant and up to date, we'll add a question or revise a question here or there. It is technically a year certification, but more honestly, more like 15 months, because if you did apply in September, your certification would be good through March, that March 31st deadline. So a little bit longer than a year. And if you apply by this deadline March, good through March 31st of the following year. And then any organization who chooses not to renew, or they're, maybe they want to take some time to work on some things internally or whatever the case may be, that certification will expire March 31st as well.
Yeah. And what do the costs look like for recertification?
It's the same thing as original application. It's that $99 to $299 depending on the size of the organization.
Definitely. Another question that I had come in was, what type of organization is this certification appropriate for? This person specifically is working at a faith-based institution, an Islamic center, and is just wondering what type of workplaces would this be beneficial for, and would that be something beneficial for them?
Yeah, I mean, I'll admit, trying to create a standard that's applicable across all these different types of workplaces is very challenging. We have, and it has been a lot of kind of experimentation and working directly with companies to see what works and what doesn't. But we have had organizations that have fewer than 10 employees achieve platinum. I think the organizations that it doesn't work well for are if you're like, an independent small business owner, or you're kind of an employee of one or two, it's not as applicable. We've worked with companies where the situation was like they're one small site independent of like a larger organization, and they kind of applied on behalf of that location was an option. So it is a bit of a case by case basis where if, honestly, if you just wanted to reach out to me by email or after this webinar, we can kind of talk through what some of the options are, because every case is, it really depends. But I do encourage everyone though to take a look to see if it's something that might be applicable for your organization, because these are general just best practices that we know work to help improve worker mental health outcomes.
Absolutely. Someone else asked if there's a limit to the number of organizations who can earn or be awarded the Bell Seal each year. Do you cap it at a certain number? Are they compared towards each other, or is it just that standard seal that each will be looked at?
Yeah, there's no cap to who can receive the certification in a given year. Although if they don't meet that at least 50 point out of the 100, then they're not qualified. And most organizations that have moved forward with the full application process have been working closely with us, have achieved some level of recognition. There's only a handful that are kind of working towards getting to that 50 points at the moment. So I don't even know how to interpret this like data, because I'm still wrestling with it, and something that I looked at the other day. But with that pre-assessment tool, it was like 87% didn't qualify yet. And I anticipate that's a lot of individuals who are maybe workers of an organization who aren't that happy with the way things are going, or there could be a number of different reasons to be like, are we participating in any of these things, versus organizations who do move forward with the full application process. It's like they've been doing this for several years, or this has been top of mind. It's the folks kind of participating on this webinar, and so a little bit of a different population. But I totally forgot what the question was and just went on a tangent.
Great. Kind of off of what you were saying with that pre-survey that folks can take that isn't the full application, is there a cost or requirement associated with that? Can anyone take that? Where could they find that type of information? A few people asking.
Yes. So you can find the pre-assessment like on the Bell Seal website, which is that mhanational.org/bestemployers. It's free, it's really quick, and it's pretty accurate. It's for people who have gone through and received their score. Or they've actually had a better score when they went through the full process, which is great to hear. So the tool might be a little bit more challenging. Yeah, no requirements for that. We don't even collect any information about your organization, emails, anything like that. It's just, just the checklist.
Absolutely. I know we have people asking for links too. All of those links will be included in the follow-up email. So if this is something that is piquing your interest and, that would be a great place to start to really take a look at where your organization's at. I know we are right at our hour mark, so I don't want to go too much farther over, but I'm going to do one last quick question, Taylor. Someone asked what kind of feedback we receive from the recipients in terms of recognition. For those that are recognized with Bell Seal recipients, what are you hearing from them as this moves forward?
Does this just mean like what the process is like for them, or?
Yeah, process and any feedback they have from employees or changes that have been positively made, those type of things.
Oh, okay. Well, I can answer this in two ways. So one would be to check out that brief about the specific examples employers have done in relation to, I mean, it's been everything from building up caregiving benefits has been a really big thing, or the ability to bring the pet to work. It's a wide range of things, and there's a ton of examples outlined in that June brief. Again, it is linked in the slides, so I would take a look at that to see what some of the, like how employer feedback drove some of those changes within a workplace. And then I think, if I'm understanding, trying to figure out what the question means, but just the feedback that we've heard about organizations that participate in the program is that it's been a really simple process, a really easy application to complete. Not a whole lot of technical issues, which is good to hear, because when we first, and I kid you not, when we first started the program, we were receiving like these thick binders in paper it was terrible. So we've come a long way from there. And it seems like it's a pretty good, clear process for individuals. It's even gotten to the point where we're working with some of our organizations that are renewing, and they're like, I don't even need to have a call. Like we've done this before. We've kind of gotten the gist of it. So it should be hopefully a smooth process for people.
Perfect. Thank you, Taylor. I know that we presented you all with a lot of information today, but hopefully everyone who is here now has some added background on what it could look like for their organization, how you can move forward, and if this is a path you want to take, or starting with that survey and seeing where are some things that we can focus on to then get to the point of applying for this type of recognition. So thank you, Taylor, for joining us today and sharing all of that wonderful information and for providing such great resources. We'll send all of that out in your follow-up materials, as well as the recording. You'll get the slides, and then we'll send some of those links as well. So thank you all so much for joining us today. Thank you for your thoughtful questions. We really appreciate you being here and look forward to hopefully seeing some of Bell Seal applications come through soon. Thank you, Taylor.
Thanks. Bye, everyone.